Hi everyone, I'm Helen from Queen's Hospital, Barking Havering Redbridge University Trust, and welcome to today's Ask About Asthma video on how we can support transition through group consultation clinics. So we have recently set up and run our first group consultation clinic for transition. We were looking at a way of delivering education and all of the aspects of transition from children's into adult services to our young people who have asthma. So we were looking for an informative educational session which incorporated the opportunity to ask questions, to share personal experiences, and to discuss as a group the things that young people would want to know when they are moving from children's services into adult services. So we've just run our first transition clinic. This has been a huge success. We had a lot of positive feedback from our young people. So when we were looking at setting up our transition clinics, we worked on the basis of our group consultation model. So every one of our young people, they get a 45-minute teaching session as a group, and then they see us on a one-to-one basis afterwards. Now, prior to transition, we agreed that we would call our patients beforehand to make sure that we were completing a full review, making sure their medications were correct, that they were well controlled, and if they weren't well controlled, that we would make sure that they were well controlled before they came to clinic, so that the transition clinic itself could focus purely on the things that they needed to know to be safe moving from children's into adult services. They would also look at what to expect when they go into adult services. We also give them the contact details for the adult team so that they can know who to contact and where their next appointment would be. And obviously with asthma, some of our young people will be discharged back to the GP. So again, it's the education session and components of that we were looking at various different topics. So smoking cessation, vaping, sexual health, contacts. We don't teach it in our session, but also including some information about young minds. We also have reliable links for them with regards to their asthma. We also look at their asthma plan. We look at what they need to do from escalation of treatment to worsening symptoms and what to do in an asthma attack also. Our education session also includes information about what asthma is, how we manage the symptoms, how we avoid triggers, and what we need to do to keep ourselves well. It also incorporates topics such as how young people access their medications, how they access their prescriptions, how they can order their prescriptions online. These are things that we thought our young people would really want to know, because you don't know what you don't know. So our young people may have never ordered their prescriptions previously. They may never know how to make an appointment to see their GP. So we wanted to give them the access to be able to do that. We also wanted them to know, and for us to know, that when we were discharging them, that not only did they have the information that they needed to be safe and be able to safely support and manage their own condition, but also that they knew where they were going to be seen next. So they knew whether they were going to the GP and when they're expected to be seen by the GP, or if they were going to adult services, that they would be seen by the adult team and who those people were. So what we found from doing our group consultation clinics, particularly with transition, is that the young people have had the opportunity to discuss their asthma. They've been able to discuss their symptoms, their triggers, and learn from other people about what works for them. This is always good to share this learning and to know that you're not alone when you're managing a chronic condition. So it also gives them the opportunity to form friendships that, you know, may last beyond their clinic as well. That brings today's episode to a close. Thank you for listening, and please do visit the Ask About Asthma webpage for more videos, podcasts, and to view the full schedule for the week. Thanks and goodbye.